Okay, so we might get started, everybody. Hi, my name's Trent Twomey. I'm the National President of the Pharmacy Guild of Australia. I'm here today with John Dowling, a representative from the Guild in Tasmania, and Anthony Tassoni, our Victorian President. And we are in Exhibition Pharmacy with local pharmacist and Pharmacy Guild member Steve. And I stand here today exhausted and frustrated. The Pharmacy Guild of Australia is sick and tired of having pharmacies around Australia being bombarded by Australians who want to get the vaccine and cannot get the vaccine. The Pharmacy Guild of Australia's members have lost patience and had enough, and now I've lost patience and I've had enough. I was really, really annoyed this morning to wake up and hear that the Commonwealth Government is considering sending 20 million AstraZeneca vaccines to the Pacific Islands. Now, I'm a far north Queenslander. I live in Cairns. I know how important it is for the Australian government and the Australian people to show leadership in our region, but it is not good enough that over half of the Australian population are now entering a lockdown. Australia, in terms of the number of people that have been fully vaccinated, rates dead set last in the OECD. We rank number 37 of all of the different countries. 4.4% of the entire population is vaccinated, and only 7.1% of the Australian population is vaccinated. I don't care which vaccine. I just want Australians to have the option with informed consent to be vaccinated. Now, it is a very strange day where you see the Pharmacy Guild of Australia as the peak body for community pharmacy, an employer body, standing up only hours after Sally McManus from the ACTU, and we have exactly the same view as the ACTU. It is up for Australians to choose which vaccine they want, not up to the Commonwealth Government politicians. The Australian Technical Advisory Group on Immunisations, the TGA, has approved the AstraZeneca vaccine and the Pfizer vaccine for all Australians over the age of 18. Sure, there is a preference for certain age groups to have certain types of vaccines, but it should be up to individual Australians as they are going into a lockdown to choose which vaccination they put in their bodies. There is a 3.1 out of every 100,000 people who receive the AstraZeneca vaccine may have a side effect. That is 0.0031%. 0.0031%. And you know what? No drug is without its risks. And the people of Australia want to have a conversation with their medication experts about what vaccine is most appropriate for them and what vaccine is most appropriate for their family. And guess what? Guess what, Commonwealth Government? The people of Australia are having conversations with their local pharmacists about all of their medications. No medication is without risk. Pharmacists have been vaccinating in Australia now since 2014. We administered over 3 million influenza vaccines last calendar year alone. 3,930 pharmacies have been approved by the Commonwealth Government. 3,930 pharmacies have been approved by the Commonwealth Government to administer vaccines. And here we are exporting 20 million of them to overseas countries while half the population is going to lockdown. It's not good enough. I've had enough. The pharmacists have had enough, and the people of Australia have had enough. It's their choice. It's their choice. It's not the politicians' choice what vaccine they choose. Happy to take a few questions.
Yeah. Look, I don't believe all pharmacies can even administer the vaccine at the moment. What are your thoughts on that?
So there are 6,000 pharmacies in Australia, and 4,000 of them volunteered. They heeded the call from the Commonwealth Government all the way back in March, and they said, you know what, I'll put my hand up. I'll put in vaccination rooms, just like Steve's done here. I'll go and do the extra training as mandated by the Australian College of Nursing, just like your GP's done, just like the nurses have done, just like the people working in state and territory health facilities. They're trained, they're qualified, they're trusted, they've got the infrastructure, and the Australian population want to get the vaccine, and they just can't do it. It's ridiculous.
How do you feel about this back and forth? You can get the vaccine, you can't, now you can. What's your response to all of this up and down and mixed messaging?
We have completely bungled the messaging. We have tens of millions of vaccines sitting in fridges between state and territory governments and the Commonwealth Government, and we have tens of millions of Australians who want to get their vaccine. So the problem with the messaging is we chose at the outset a complicated approach. A phased approach, phase 1A, 1B, 2A, 2B. Look at the rest of those 36 countries that make up the 37 of the OECD, and they had a much simpler message. If you're over 85, it's your turn. If you're over 75, it's your turn. They did an age-based approach, which is what we should have done. It's what the Guild said all the way back in January what we should have done. And we're sick and tired of these so-called experts, these faceless men in the Commonwealth Government bureaucracy that are providing goodness knows what advice up to these elected officials. We have the premiers on board. I'm here in Victoria, and we know that Dan's back on deck and he's supportive of community pharmacies. We know the Premier of South Australia, the Premier of Queensland, the Premier of Tasmania, the Premier of Western Australia. They're all on board. Stop hiding behind National Cabinet and activate community pharmacy.
What's causing the opposition to pharmacy, Trent? I know when I spoke to you last week, you were saying that some, like Tasmania, I noticed John there behind you, I mean, in particular, hadn't come to the table as yet. So what's causing this resistance?
What's causing this resistance is a fractured approach at a national level. We did not see this rubbish when we rolled out the General Practice Network. There was no hiding behind National Cabinet from the Commonwealth Department of Health. Brendan Murphy needs to step up here. The amount of times I personally have extended my hand of cooperation to the Secretary of the Department of Health and it has gone unanswered, he deserves to take responsibility for this bundled rollout. Brendan Murphy is nowhere to be seen at the moment. He was rolled out by the politicians as the medical expert and everyone heeded his advice. And where is he now? He's hiding behind the General. And I know I've got a good hookup with the good General later on today, and I'm really hoping he can bring some common sense to this bungled strategy. It has been bungled, it has been mishandled, and hopefully to goodness, he can wind back some of the over-engineering and complicated messages that has plagued this rollout.
Would you still recommend people have a chat with their GP about getting the vaccine, or should they be having that chat with their pharmacist?
People should have a chat with any trained health professional. Go and have a chat to your local GP. Go and have a chat to your local pharmacist. Go and have a chat to your local community nurse. All of these people are qualified. All of these people are trained. All of these people are trusted. Whoever you trust and whoever you have access to. And, you know, this rubbish that the Commonwealth Government says that there is only an access point in regional, rural and remote Australia is nonsense. I'm standing here at Exhibition Pharmacy in the middle of the CBD of Melbourne. Accessibility is not based on your distance from a capital city. It could be based on a time of day and it could be based on a day a week. And the data shows community pharmacy is more accessible in metropolitan areas than any other piece of health infrastructure, just as much as it is in regional, rural, remote Australia.
And just quickly, concisely, what is your message today? What do you want?
Our message today is don't you dare send tens of millions of vaccinations to overseas countries as part of a humanitarian crisis when we have a humanitarian crisis here at home and half of Australia is in lockdown. Shame on you, Brendan Murphy. Shame on you. Thanks very much, everybody. Have a good day.